All right. In this lesson, we're going to talk about post-traumatic stress disorder or PTSD. Now, PTSD is a mental health disorder that results after someone experiences some sort of trauma. Now, this really could be any kind of trauma. Now, it's commonly associated with, war veterans, but it's also seen in victims of rape or abuse, people who've been in traumatic accidents or have survived natural disasters or been victims of a crime, etc. So any kind of trauma. There's a lot of people who lived through things like Hurricane Katrina or the tsunami in Asia that are now suffering from PTSD. And unfortunately for them, one of the hallmark signs of PTSD is that they relive that traumatic event over and over. They may dream about it. They may have flashbacks. And all of those things are going to begin to affect their ability to function on a daily basis. So patients may experience issues sleeping. I mean, can you imagine if every time you fell asleep, you had a nightmare about the worst day of your life? They have these nightmares and it causes a lot of anxiety and a lot of depression. And all of this begins to just stack and compound on each other because then they're too anxious to sleep. And even if they do sleep, they have nightmares and that makes them more anxious and more trouble sleeping. And now it makes them depressed. It just becomes this cycle. They're exhausted. They're probably irritable. It can lead to this really dark hole of depression. Now, many patients with PTSD will begin avoiding their triggers. Now, normally we would say this is a good thing, but it can actually be very limiting in their lives. Now, patients with PTSD will also be hypervigilant. They're always looking around. They're always on edge, trying to possibly figure out how they could get out of a situation if they needed to. And then they'll also experience guilt. This could be something like survivor's guilt, which says, why me? Why did I survive and someone else didn't? Or it could be a guilt because they feel like maybe they could have done things differently. All of these things just tend to compound and cycle. It feeds back into this anxiety and depression. And it makes it just really difficult for someone to cope with their daily life. So what do we want to do for them? Well, no matter what the situation, we want to always validate their feelings. Sometimes just having someone say, your feelings are valid, you're allowed to feel what you're feeling, can be so powerful. We want to promote whatever coping mechanisms work for them. And I actually want to add here, healthy coping mechanisms, right? So maybe they want to journal, or maybe exercise is healthy for them, maybe some yoga. Choose a coping mechanism that actually works, keeps them out of the danger zone, prevents a panic attack. We also highly encourage therapy and support groups. Just knowing that you're not alone, it's powerful enough, but also being able to share what works for them is really very helpful. And there's also even service dogs that are specifically trained to identify emotional agitation, anxiety, so we can help connect them with those community resources as well. And then finally, we want to help them identify their feelings, identify their responses to certain situations, what their triggers are. And sometimes therapy may have to help them identify even, what the traumatic event was, because they may not know right away. I know for me personally, there was a lot of repressed memories. Remember that defense mechanism we talked about? And they kept me from really understanding why I was feeling the way I was feeling. So getting that help to kind of process through what you're feeling and make sense of it is really helpful. So again, our number one priority is going to be safety. Clients with PTSD are actually at a very high risk of self-harm and suicide, also just self-destructive behaviors. So we want to promote those positive, healthy coping mechanisms, coping strategies, and assess their mood and affect. Look for things like helplessness, hopelessness. Those things are going to be an indication to you that there might be depression and might be that risk of self-harm. So let's recap quickly. Post-traumatic stress disorder, or PTSD, often occurs after a trauma of any kind, and clients will start to relive that trauma over and over through dreams, flashbacks, nightmares, and just a general anxiety. This is going to start to affect their daily life, whether because of sleeping issues, that anxiety, or just being hypervigilant all the time. We want to help them find healthy, positive coping strategies like relaxation, therapy, connect them with therapy and support groups and resources. And then, of course, always put safety first, assess for that risk of self-harm. So that's it for the basics of PTSD. Be sure to check out the patient story, which is actually a collection of patient stories, and the rest of the resources attached to this lesson to learn more. Now go out and be your best selves today. And as always, happy nursing.